I'll do a little intro about me in a second, but this is essentially a bit of a roundup. Maddie's asked us to do a bit of a roundup of the work that we've been doing at the Royal College of Paediatrics and Child Health. So I think I'm the only doctor in the room today, which is actually kind of unusual at the moment. But so I really apologise if any of my language is a bit too doctory. Please feel free to shout me out about it. Yeah, so I'm going to do a little presentation about the work we've been doing at the Royal College of Paediatrics and Child Health, which is London-based, but the work is national. Some of it's international, and it should be applicable beyond the realms of medicine, actually. I think air pollution is quite a kind of cross-sector topic, isn't it? So hopefully it still feels relevant to you guys. And I thought I'd just do a little intro to say, so this is me. So I have been involved in air pollution probably over the last about 7 or 8 years. So pictures at the bottom, I did some work with a college living in Rwanda, and that was my first kind of experience of climate change and the real impacts of environment on health. And then I came back and had 2 kids and was not able to do as much traveling, but got more interested in kind of public health and deprivation on the doorstep. And I think air pollution is a big part of that, because it's obviously most affects more sort of deprived groups in our community. And then with my children, I've been really kind of influenced to want to be active with them and to travel in a sustainable way. So that's a picture from a couple of years ago of them going to nursery in the double buggy and doing kind of cycle rides with other paediatricians to raise awareness of air pollution. So that's kind of me. And at the weekends, as Zara knows, I can be found up a hill. That's my like happy place, and obviously the air quality there is very nice. So we've been doing a project for the last year that's been funded by the Clean Air Fund. It's actually due to finish next month, which is very sad. It's been a really great opportunity because we've had a lot more resource in the college to work on specifically air pollution. And there's been 3 clinical fellows, Zara, our project manager, we have done a kind of 3-pronged approach of things around education, around advocacy, and some research as well. And I thought I'd kind of present it to you through the medium of our website, because that's where you can find all the information for people who aren't here today. In terms of how we've thought about our approach to air pollution and how to tackle it, we kind of looked at the barriers. There's some really good research from Clean Air Fund and also just from speaking to our members. And people have said that these are the main barriers that they've come up against. So, these really resonate with me as a clinician. So my headspace is occupied with higher priority issues. So if you've got a dying child, you're not necessarily going to worry about their breathing right then. Misunderstanding the problem, so thinking it's for experts rather than for generalists, which often we are as medics. Maintaining our standing, so particularly with the kind of news and publicity around kind of climate activists getting jailed, there's a kind of worry, isn't there, that if we speak up about things like the environment, public health, that it could damage our reputation as medics. And then kind of lack of inspiration, like actually I don't really know what to do about this. And then also, this is such a big problem, like what on earth are my patients meant to do about it? And if I haven't got, medics are very much a kind of, if there's not something tangible to do, then like we just don't want to talk about it. Like we need a solution before we can kind of approach the fact that there's a problem. So we've tried to think and make things sort of quick and easy, provide clear, simple information, try to make air pollution mainstream. And I do think that is something that we've really done over the last couple of years, because the college has got behind it as a issue, I think, and it is in good standing. The college is in good standing. I think that has helped to make this a mainstream issue. In terms of inspiration, we've kind of, I'll tell you about some of the case studies we've been looking at. And then in terms of helplessness, we've tried to kind of offer practical examples of things that people can do and things that people can tell the patients to do as well. So this is the kind of slide with a little link to our air pollution companion, which is our website that houses all our stuff about air pollution. And this is what the kind of home screen looks like. And I'm just going to whiz through, not all of it, but kind of 4 of the main bits of it, just with some examples of what we've put in there. So we kind of recognise that for medics, there is this kind of barrier of knowledge, and so we needed to start with that. And then no one can really kind of communicate or advocate if they haven't got that baseline knowledge. So within the knowledge, we've included this position statement, which we wrote last autumn, and we've had good feedback from members that actually having quite a clear position statement about air pollution and its impact on young people, and then recommendations for kind of different cross-sector organisations, that has made it much easier to advocate, because you can literally print this out and put it on the desk of decision makers. I know I've certainly done that in the Northwest. And you'll see that there are things on there like around expansion of our law, which like now very pleasingly looks like it's going to come to fruition. So it does feel that we've been able to be part of that conversation. But yeah, so that's both advocacy, but also the kind of background knowledge that is housed in that section. And then we've got a communication toolkit, again, broken down into kind of how do you engage with young people and families, how do you talk about air pollution, and then some resources to go with that. And talking about air pollution, so we've come up with a few different things. So this is shamelessly stolen from Global Action Plan. They already had a kind of similar pathway for primary care and opportunities to talk to children and their families. Well, the Global Action Plan one was for all ages, but ours obviously is more of a young person angle. And it's if you've got a young person and their family travelling through the hospital in an outpatient setting, like what are the opportunities you've got to raise air pollution? So it could be in the letters that go out to them or in text messages, it could be in the car park, it could be signage there, it could be in the waiting room, it could be before the consultation happens, kind of looking at where somebody lives. Have you got some beautiful monitoring like you've got in Breathe London? You know, as a clinician, have you cycled and walked to work, and can you model that? Or, you know, and then once you're in the history and examination, having those conversations, like making conversations about housing matter of fact, using how did you get here today as a way to talk about transport and activity, and then incorporating air pollution into your management plans, even if that is just signposting to Global Action Plan resources or whatever resources it is, but just starting to have air pollution as kind of business as usual for clinical consultations, which it hasn't been previously. So this was we made this in conjunction with RCPCH, which is like the engagement wing of the college, so with young people, and they gave a lot of feedback. There was an initial draft which looked totally different. It got torn to shreds, which was brilliant, and then we rewrote it based on what they felt was more appropriate language and what wasn't kind of making assumptions and putting too much pressure on young people and those sorts of things. So yeah, that and other resources exist. And then we did quite a cool project with Great Ormond Street and Camden Council, where we, one of the physios there had already started writing some scenarios about where you might be able to talk about air pollution. And we've done some videos. And I think if we've got time, Maddie, I can play this video. It's about 3 minutes long. Is that okay? And I'm just going to check.
Go ahead.
Make sure that tell me if you can hear it, because I didn't press a button to say share sound. So can you hear that?
You've been doing really well with your physio.
Yeah, coming through well.
And I think we're probably looking towards finishing physio for now. If you continue with the exercises that we've been going through, you'll be able to get back to the things that you want to do in kind of 2 or 3 weeks or so. Have you thought about where you might exercise or when you might exercise at all? That's great news. I usually just walk home from college, or usually about 5 to 10K steps a day. The reason I ask this is because you've got asthma and sometimes use an inhaler. When you exercise, you take deeper breaths and then more air gets into your lungs. If some of this air is polluted, that can irritate your lungs and sometimes exacerbate your symptoms. So what does that mean for me? So what that means is that we want you to keep exercising, definitely, but sometimes just consider where and when you exercise. Whether this be thinking about the location. So if you're exercising, think about whether you're in a green park or on quieter roads where there'll be lower air pollution areas. Whereas if you exercise on a big busy road around rush hour with lots of traffic, that's the areas with high air pollution.
So I can keep exercising. I just need to be mindful about where and when.
Absolutely, yes. And as I said, just think about the timings, but that might not always be if you're coming back from college and that's when you walk. We'd always rather you walk and exercise than not exercise at all. Just maybe try and plan a route that's slightly away from busier roads where possible.
Okay, that makes sense. Is there a map that shows any polluted areas around?
Absolutely, yeah. So some weather apps can show you the pollution air levels in your area. Some exercise apps can show you, but also if you look on your phone, there's a website called UK Air Forecast that can show you that as well and give you that information. It's also good to be mindful of the weather. So if it's smoky or if there are kind of like a heat wave, something like that, that can also increase air pollution. So just listen to your body as well as kind of using the apps and the forecast as well.
Is there any other information that I could use?
There's a leaflet that we've got on the screen up here that will kind of talk about your air pollution plan that you can take away with you today.
Okay, so essentially I can keep walking and keep doing these exercises to build my fitness. I just need to be mindful about when and where, and to look out for polluted areas within that.
Yeah, absolutely, that's it. And also listen to it.
Okay.
So big thanks to Nicola, a real physio, and Angela, a real patient from Great Ormond Street, who just sort of volunteered their time to be part of the project. And that the QR that's on there, oh, thanks, Maddie. Thanks, Steph. That's one of 4. So there's videos with a GP, a midwife, a hospital doctor, and a physio, and they're all it's on our RCPCH learning platform, which is you can get to from our main website. And it currently exists as a kind of modular thing, as a kind of learning resource, and you can click through all the videos. There's really good FAQs which you can download as a PDF, and then it auto populates the certificate. So the reason for doing that was to make it a kind of learning resource for CPD that paediatric trainees would be interested in using. We are kind of analysing how effective that is, because I think possibly a barrier by having it behind a bit of it's behind a login. It's an easy login, but it is still behind a login, and it might be that we end up having to move that onto the kind of main website, just remove the login, because obviously the ultimate aim is for it to be as accessible as possible and as widely used as possible. I know at Great Ormond Street they're also have embedded these videos just into their electronic patient record, where they flag up air pollution on the electronic patient record, but that's partly because we filmed it there and they've got a bit more a bit more sway. Tanya, you've got your hand up.
Yeah, thanks so much, Alice. These are great. Sorry if I missed this, but what leaflet is she referring to?
So the leaflet she's referring to there is actually a Global Action Plan leaflet, and they may well have been updated. So we filmed this in December, and I know there have been some updates happening with the leaflets. But so this is one, and so where the videos are housed, we've got the link to the leaflet on our website. But it's the talking to children and young people about air pollution, and it's like a checklist that says, like, think about how you walk, like is anyone smoking in the home, like goes through a kind of bunch of different environmental factors, and the language is such that you can do it with a child and a young person. It's not just aimed at the parents, if that makes sense. Is that okay?
Thank
you. I can definitely find the link to the specific website afterwards as well.
That's okay. I can have a look around.
You can find it. But yeah, it's Global Action Plan. We love Global Action Plans. Oh yeah, Laura said it. Great. So I'll continue. So then another part of our website, we've done a bit of advocacy, because our funders, Clean FM, are really keen for us to get health professionals advocating more, because we know that Ipsos Mori always says that doctors are pretty high up there in terms of being trusted voices. We're not as trusted as nurses, but we're quite trusted, and therefore we've got this kind of moral imperative to use our voice for good and to try and advocate, not necessarily just on a one-to-one meeting a patient kind of point of view, but actually at more of a kind of population level. So one of the things that my colleague Emily did was create a media guide with our media team about kind of how you could approach your local media, how you can create a message and convey it, and some tips for that. And then we've been able to put that into practice as kind of clinical fellows. So for example, my colleague Harry, and one of the other fellows, has recently been quoted in a Guardian article talking about his perspective, and very much bringing the perspective of what we see in clinical practice, and why politicians need to do more about air pollution. And we've been lucky to have some media training, but also we sort of tried to share this learning with other kind of interested doctors and paediatricians in our kind of clean air network in the college. And hopefully we're hoping that this kind of advocacy is more will be applicable beyond just air pollution in other health policy areas as well. And then excitingly, one of our kind of areas of research, we've just released a report around clean air clinics. So it looks like this: Clean Air Healthy Childhoods, released a couple of weeks ago. And this is around clinics happening in London and also in Liverpool. Quite different clinics, but both interested in environmental health. London more research based and Liverpool slightly more clinical based. And so we had the privilege of speaking to the clinicians involved, and then also some work with some of the young people and families, and then a survey out to other general medics to say, what is your experience of young people and air pollution and indoor and outdoor air pollution, and would kind of environmental health clean air clinics be a useful thing for you as paediatricians? So if you haven't already seen it, I definitely recommend a look at the report. Again, we've tried to tie in our recommendations with our previous air pollution position statement and direct it at various different levels. So we, again, very keen on Awaab's law and kind of making sure that we are meeting WHO guidelines for air pollution, but also guidance for clinicians around educating ourselves, making sure that our curricula include environmental health, which was some of the recommendations from the coroner's Prevention of Future Deaths report for Ella Kitty Deborah, and extraordinarily 10 years down the line are still really not in place. So yeah, quite wide ranging recommendations that I would encourage you to look at. But that has also led to us being able to enter spaces to advocate in a way that I don't think we were previously. So this is my colleague Harry and Phyllis in a MedAct roundtable in Parliament talking about health and housing and the impact on young people and their health. And it's quite interesting because really our project initially was very much focused on outdoor air pollution, but it has kind of segued to include indoor air pollution because you really can't talk about one without the other. And they're both so fundamental to children's health. I thought I'd just very briefly touch on challenges because it's always interesting to know what people have found hard, and I think it's helpful for other people to learn from it as well. So, I mean, it's been a brilliant project. It's been challenging from a funding perspective because it's such a short-term piece of work, and I think that's the case for lots of our projects. And that's meant that we've spent time kind of winding the project up and down more than getting things get done some of the time, but and we are still not totally sure how it's going to keep going. We will be handing over to permanent members of the college for some areas of our work, but we don't have a complete vision for the future. We've definitely had a bit of an experience of an echo chamber, so lots of meeting contacts over and over again and feeling that everybody must know what we know, but actually there are lots of people who aren't interested. So for instance, from a paediatric point of view, we've really tried to get at trainees through things like their curriculum, through their e-portfolio. So even if you're not interested in this, it's a great way of getting yourself signed off for another year of practice, if you can reflect on having done some work around air pollution. And similarly, the kind of efficiency side of things, there's great stuff going on. How do we amplify rather than duplicate? Which is why we're very happy to share Global Action Plan leaflets rather than create our own. And it's been a real pleasure to work collaboratively. Actually, that's one of the lovely things about this work. And for us as a college, it's what is our unique child health voice? What is it that we bring to the table? And I think that is our angle, that we can just basically say, but what about the children in every meeting we come to? So in terms of what next, my doorbell's just gone. I'm back to clinical practice, so I'm really trying to practice what I preach. The project is funded until this August and then see what happens next. But we have really seen a change in business as usual. There's definitely more incorporation of air pollution into wider health policy. In things like the State of the Child Health, which is a report we're doing at the moment. And we've got these lovely collaborations, which I very much hope we're going to kind of continue beyond the remit of this project. So yeah, that's me done. This is our kind of generic email. So please do feel free to get in touch. There'll be somebody there, even if it's not me. And yeah, open to any other questions. Thank you.